A formulary is something most people run into at the pharmacy, even if they've never used the word before. It's the list of medications a health plan covers and how those medications are grouped for coverage. It's not a list of every drug that exists, it's a working list that reflects how a plan has decided to cover different treatments. Most formularies are organized into tiers. Those tiers are what drive how much someone pays out of pocket when they pick up a prescription. A simple example looks like this. A tier 1 drug is usually something very common, like a generic medication that's been around for a long time. These tend to have the lowest copays. A tier 2 drug might be a brand name medication that's widely used but more expensive. Higher tiers often include newer drugs, specialty medications, or treatments used by smaller groups of people, and those usually come with higher cost sharing. So when someone is told a medication is on a higher tier, it's just how the plan has grouped it for coverage and cost purposes. Formularies exist because prescription drugs aren't interchangeable in the same way retail products are. There are often several medications that treat the same condition, but they can differ in price, dosing, side effects, and how long they've been on the market. The formulary is how a plan puts some structure around those choices. It allows coverage decisions to be applied consistently across large groups of people instead of being made one prescription at a time at the pharmacy counter. Formularies can range from open to closed, and an open formulary generally covers most prescribed medications, even if some of them come with higher cost sharing or additional requirements. A closed formulary covers a more limited set of medications, with coverage focused on specific options selected by the plan. That difference often explains why one medication is covered automatically, while another requires an exception or a different approach. Formularies also play a role in safety and appropriate use. Some medications are intended for very specific situations or patient populations, and coverage rules reflect that. Those rules live within the formulary framework. Formularies also change over time. New drugs are added, others move between tiers. Some are removed as treatment guidelines evolve or new options become available. That's why someone might notice that a medication they've taken for years is suddenly handled differently at the pharmacy. Formularies are closely tied to the rest of the pharmacy benefit. How a drug is listed affects not just cost, but how prescriptions are processed and whether additional steps are required before a medication is filled. When someone runs into a formulary issue, it usually shows up as a higher copay, a coverage requirement, or a need to switch medications. Those experiences trace back to how the formulary is set up. In future videos, we'll keep breaking down other confusing parts of pharmacy and healthcare, one piece at a time.